Good evening, everyone. This is Maha. I'm the country director of Plan Thailand. And good morning, good evening. It's 10:30 here in Bangkok. So anyway, thank you very much for having me here tonight to be able to present to you our experience on PoiMapper. We thought that for those of you who may not know Plan International or have forgotten about Plan International, we just want to give you a little bit a reminder about who we are. We will be 75 years old next year, an international development organization, and our vision has remained the same for so many years, making sure that children reach their full potential in societies that respect their dignity. And this can be, we try to accomplish this through the various programs, as you will see also in Kenya and in Plan India, making sure that we have programs that respond to the rights to survival, development, protection, and participation of children. We are in 68 countries right now. And again, basically, those are the basic things about Plan Thailand. Plan International. I've been in Plan Thailand too long now. Let me speak a little bit about the experience in Plan Thailand. Perty mentioned that there had been discussions earlier, actually in 2008, actually, Perty, when I was still in headquarters and I was in charge of the sponsorship and grants, and we wanted to use a handheld device at the back of our system called child data. So we have had a long conversation about this. And then I left headquarters and I did not hear anything anymore until I saw a report on the Kenya pilot. My vision, having worked with Perdy and Christopher when they were back with Nokia, was really having a real-time data, real and paperless. So when I went to Thailand, and I know the basic challenge for many of the countries, many of the planned countries, when it comes to reporting and monitoring, we always require people to have timely reporting, but we always scramble for the data because there is not systematic, or most of our data gathering, as many organizations are doing, are so paper-based. So when I came to Thailand, I said, I would like to have real-time paperless monitoring so that we can be much more, we have less mistake, less entering when it comes to gathering the indicators for our yearly or even quarterly reporting. So we had a global fund project, which is the tuberculosis. It's small enough that we could not really pilot, but start using the PoiMapper. So when I got the report on Kenya, I communicated immediately and said I would like to use PoiMapper. So knowing the whole value of this, I really did not go into piloting anymore. I spoke with Christopher and Perty and said, let's do this in Thailand. So you will see here that basically for us, the mobile location data collection really eliminates all of this paper and pencil work. And what happens is when the staff start using paper and pencil, they disappear at some point, and they misplace all kinds of things. The data collection is delayed and the reporting naturally is delayed. I will not go through each of these things that are written in this, on this slide, but basically I wanted to have a much more efficient monitoring of our project. So we started with the tuberculosis project, which is a global funded project. So these were our objective, really. The project strategic objectives of using PoiMapper is so that we can have a more efficient processing of monitoring, that there will be an immediate sharing of data between the country office, which is in Bangkok, and our areas in the north of Thailand. And then at some point, if we need to share, considering data protection and all of those issues, but if we need to share certain information with our donors, for example, with Global Fund, we can immediately share with them, again, real-time report on what's happening on the ground. Okay, I'm just moving on to the next because I don't want to. What happened was, as what Pertis said, they have some technical people, and I think this is one thing that we appreciate. They have one technical person here in Thailand, and that made it very easy for us to get our staff trained. The first person who was trained was our ICT manager, who in turn trained all our staff using the PoiMapper. And this is really sales talk for Payat, that they train very well, that our ICT manager actually doesn't need any further technical people because he knows exactly what to do. He would have some questions, but pretty much it's really the transfer of knowledge has been done very well by the technical person. So our team was trained on the use of the PoiMapper. And then they started using the PoiMapper and gathering data. Now, this tuberculosis program, what we're doing here is really tracking, monitoring the patients. And most of the patients are migrants. So it's very, very helpful to have this when our field workers walk around. They are able to immediately gather information about the medication that has been taken, or if the medication has not been taken, or any issues that that might be confronting the patients. And I can see immediately where those patients are, where the patients are located. If I want to know the number of patients who receive medication, I will know that immediately. And that is really very helpful, rather than waiting for the end of the month for the staff to report.
Maha?
Yeah?
This is Frederick. There is a question from Bill Philbrick and asking about the TB program, assuming that it's a global funded program. Are you coordinating some of this data collection and data storage or this project with the government of Thailand?
Not yet, because this is really a small, I'm moving towards this one because this project, using the PoiMapper, has created a lot of attention with the government of Thailand. So the one reason why I used tuberculosis as an initial project for PoiMapper is because we are a sub-recipient of global fund in the next round, which has something to do with HIV/AIDS among children. And we're starting to talk with the government and with the PR, the PR. I forgot now what the P is. The Prime to use this technology for the next round. But there is at least in one province there is now an interest on using PoiMapper specific to disaster, which is the question of Murali, which I will go to.
Excellent, thank you.
So we are gathering the TB information, the tuberculosis information in the areas that are assigned to Plan Thailand at the moment. So the next slide is very much, again, I think pretty much mentioned. So this is our customized portal. We can point where the houses are or where the patients are. And so this is, for example, this is the one that I could look at, where are all of these patients. So I can see all of those green dots. I know where they are in the north. Then all of those information can be exported as what has been described by Perty into an Excel file. And when we are ready to report to, and this is just a very simple example, if we want to find out how many of the TB patients are male and how many of the TB patients are female, just to give us an indication of some of this data that can help us analyze what's the situation relating to tuberculosis. I'm sorry. So then, so what's happening? What are the general? Someone else is coming in. I'm sorry.
I'm trying to mute Clementine. Just keep going.
Okay. So what are the general comments of the staff? The staff are excited about the tool because they can gather and correct the data in real time when they are visiting the TB patients, as I've mentioned. They don't really need to come to the office to input the data, which we have been doing, or having the paper and then put it in their folder and lose the paper. Then the supervisor, our TB, for example, our HIV/AIDS manager can easily analyze the data in real time. And I can do that too if I want to or if I need to from the country office. And the data is coming from real tasks of the staff. So they are not really, because this is based on the action plan, so and the indicators that they need to gather. There is no inventing of something. Yeah? So it's really based on what we said we should be gathering. Now, it's not really a limitation, but this is where Christopher and Perty's team help us. We really need to use the Thai language because the users are really the Thai staff and they don't use English. Now, because of this, the government officials of the province, where we are doing this in Chiang Rai, and other country offices in Asia, and morally, there had been a conversation among the ICT managers of all the 13 countries in Asia. So there has been an interest to use this. And because we have now the capacity here in terms of technology, in terms of training, Plan Thailand is very willing to assist the country office with the help of the other country offices, with the help of PIAT, to make this, accessible to the other countries. Let me see what's the next one. What's in the works? As I've mentioned, because of what we have done, and actually we have been showing this. Part of the training is not really just the staff, because we work very closely with partners here, with CBOs. Actually, the CBOs are the ones we are training, the community-based organizations. And because they're also young, they are wonderful. They like technology, and they can easily learn these things. So this has gained a lot of this recognition, at least in the areas where we work. So right now, we are working in the province-wide use of PoiMapper for monitoring and reporting disaster situations in Chiang Rai. Right now, as we speak, there are lots of flooding in the north and lots of landslides. And the province requested our ICT manager to train, and we just trained them about 2 weeks ago, 150 people from the government, from the various districts of the province. And actually, any one of you listening here who can provide funding, I'm just looking for 10 to 15,000 euros a startup, because the government is willing to invest on the telephone. They will be buying the telephone. So this will just be the startup in terms of the use, the service that Perty mentioned, the GPS use, the server use from PIAT side. So we will assist the government in starting this app for disaster monitoring and reporting. And so, as I've said, 150 people of their staff, 150 government people had already been trained, and they are committed that in the next budget cycle of the government, they will continuously put investment for the use of technology and their disaster work. I mentioned already that the other country offices in the region are beginning to ask us to help them out with the startup. We also are working with a Canadian partner, the International Institute for Child Rights and Development, and UNICEF and Chulalongkorn University in community-based monitoring of child protection, child rights issues in the province. Pretty much it's the youth we will be training. So by next month we will input into the device the indicators that we have that had been designed by some of our partners, and we will start training 5 youth from the north just to start with, and 5 youth in the south to start. For them, the youth themselves to start monitoring the issues that affect them. I did not include it here, but by next month, we will start with our universal birth registration. The indicators had already been put in the system. I'm not a technical person, so I do not know those language, but it has already been inputted into the device, and we will just be training now the actual users for the UBR, the universal birth registration. Again, it's just like locating, in 5 years, we are targeting to register 35,000 children, and we want to make sure that they are not only registered, but we need to be able to monitor whether the services that they should have access to after registration, in fact, will be accessed by them. So we have to track whether they are in school. As we speak, the baseline research is going on because our country strategic plan has just been approved. So we are doing a lot of baseline research as our startup. And those baseline, the data that are being gathered in the baseline will be inputted right now. Let's say in the next 2 weeks, will be inputted into the PoiMapper, and the researchers will be using that, so that when we start monitoring the projects, we have something to compare it with. So I think we have created a lot of excitement here. The older people in my staff are the ones who are a little bit scared because this is new technology. But once they get a hang for it, they're excited. The young ones are very happy, and they think that, this is something that we should be doing anyway. So anyway, that's the end of my presentation. We say Kapkun ka, thank you from this is a Thai, thank you.
Maha, thank you very much.